Hi, my name is Richard Hart. I'm the owner of Elevate Fitness and Rehab. And with me today is Dr. Matt Scott, and he's a physical therapist. And we want to talk about the transition that some of our clients are making from being insulin resistant for a long time in their life to wanting to get fit and to start getting some movement into their lives. And for a lot of our clients, it's tough, Matt. It's kind of scary to go from being sedentary for a long time to wanting to start getting some movement into their lives. And it's important to move because exercise helps lower insulin. So Matt, what would you do to help a client kind of make this transition from being sedentary to being active?
Sure. So everybody has a different starting point when they're starting this journey, when they're starting to make changes in their lives. And we have to customize and adjust for each individual to exactly what their start point is. So a lot of people will see exercise classes or they'll see things on TV and they'll think, oh, that's what I have to do, but I can't do it because I'm not healthy enough or because I have this specific knee problem or back problem. And so if you can find somebody that knows what they're talking about and knows how to exercise to control insulin, and if they can help you to figure out exactly what your start point is, and how to progress you safely and effectively through that process, that's what you've got to do. And that may be a physical therapist, and that may be a personal trainer, maybe a lot of other professionals that can help people with this journey.
Right. Well, it's nice at Elevate. We have both.
Yeah.
We have you, Matt, as a physical therapist. We also have a chiropractor on staff and personal trainers. And so we can get my clients that are really hesitant to start to get some movement into their lives to come to you, and you can do a full evaluation on them. And usually their insurance pays for it,
Sure.
And they can come in and look at their back pain, look at their knee pain or hip pain, and you can do some really basic exercises for them, either to do at home or here at the gym, and start making that progression to really get to the point where they're in a daily routine of exercise.
Sure. And just like controlling their nutrition, getting moving properly, it can be confusing because if you look online, there's a million different strategies to help with back pain, or a million different strategies to become more active.
Right.
And most of it's good information, but it's not customized to you.
Right.
And so for some people, a lot of people they'll go and walk around the mall, or they'll go and walk in the water, which is fine, but a lot of times it's not enough to get you more metabolically healthy. It's not enough to increase your heart rate enough. It's not enough to burn off the extra sugar and better control the insulin. You've really got to be more high intensity. You've got to get your heart rate elevated, and that doesn't mean an extreme level of fitness.
But getting ready to do functional activities that they'll need to do at home, getting out of bed, getting up and down from a chair, getting into the shower and so forth. And so to do those functional activities, somebody like you can help them do that and progress through that 2 or 3 or 4 week period.
Sure.
Where then at that point they can start doing some more walking and maybe come into an exercise program of some kind or group class like IQ has here.
Sure.
And but boy, it's so nice to have somebody like you that's a doctor who has been trained in this and who can help people work through some of their pain.
So can I share examples?
Please.
So for somebody that's been exercising their whole life, that knows how to do it, coming and doing a personal training class that you're going to really elevate your heart rate is the best option. I have somebody that's 91 years old, metabolically unhealthy, and you're working with them to improve that through nutrition. He comes and works with me, and his high intensity interval training consists of walking for about 200 feet. And then we sit down and rest, and walking for 200 feet is enough to increase his heart rate to a point where, for him, that's a high-intensity activity that he wasn't doing before he came into Elevate and started working out with us. And as he progresses and gets more healthy, both nutrition-wise and insulin-wise and physically, we're going to have to change that activity. We're going to make that a little bit harder and add some weights and things like that. But for him and his level, it's just simply getting up and walking.
That's been great. And by the way, nutritionally, his doctor sent this patient to us. His glucose was well over 300, and in 1 week, being on IQ's program, this morning I think it was 165.
Cool.
So he's doing well. Dr. Scott, thank you so much for your expertise and your help. Appreciate it.
Yep.